Waalaikumsalam warahmatullahi wabarakatuh.
Hello everyone, how are you today? Today we have a nice presentation for our speakers, two speakers actually. So I would like to invite the first one. Siapa dulu? Aku lupa.
Me.
All right, I will invite the first speaker is Vania with the topic is antibiotics. So Vania, the time is yours.
Okay, thank you so much, Tasha, for being my moderator. And second of all, I want to say sorry to all of you because the Wi-Fi in my house doesn't work, so I cannot open the camera because I'm using quota and the connection is very bad. May I share the screen? Can you see the screen? Okay. Yes, Anya. Okay, so I will explain about antibiotics. First of all, let's jump into the antibiotics definition. Antibiotics are the medicine that fight bacterial infection in people and also animals. How does antibiotic works? Antibiotic works by killing the bacteria or by making it hard for the bacteria to grow and multiply. Antibiotics can be taken in many ways, but I will explain the three ways that you can take antibiotics. First, orally or by mouth, you can use pills, capsule, or liquid and eat it manually. And then second, topically. Topically, it's like using a cream or cream spray or oil, and you do it to your skin. And then the last is through an injection or intravenously or IV. But for this one, the injection one, if this is usually for more serious infection that cannot be taken antibiotic via injection. And then second, I will explain about the side effects of antibiotics. The common side effect of taking antibiotics are rash, nausea, diarrhea, and yeast infection. And then the third one, I will explain about what do antibiotics treat. Actually, antibiotics only treat certain infections such as strep throat, urinary tract infection, and also E. coli. But there's also some bacterial infection that cannot be treated by antibiotic. For example, like sinus infection, also ear infection. It cannot be treated by antibiotics. So if you're taking antibiotic when you have a sinus, it won't help you. It won't help to killing the bacteria. And then next we have antibiotics example. This is what I got from the internet. Antibiotic example. First we have augmentin, flagyl, flagyl ER, amoxil, cipro, keflex, bactrim, bactrim DS, levaquin, zithromax avelox, and cleokin. And then I'm sorry, let's jump to the types first before we go to the process. For the types of antibiotics, we have penicillins, tetracyclines, cephalosporins, quinolanes, lincomycin, macrolides, sulfonamides, glycopeptides, aminoglycosides, and also carbapenems. And then last, I will explain about the process of antibiotics. Basically, antibiotics, they are naturally produced by microorganisms such as fungi to attain an advantage over bacterial population. Antibiotics are produced on a large scale by cultivating and manipulating fungal cells. But nowadays, the industrial microbiology can be used to produce antibiotics via the process of fermentation, where the source of microorganism is grown in a very large container. It can, I think it's about 100,000 until 150,000 liters or more, containing a liquid growth medium. The oxygen concentration, temperature, pH, also the nutrient are closely controlled when they are making the antibiotics via the fermentation. As antibiotics are secondary metabolites, the population size must be controlled very carefully to ensure that maximum yield is obtained before the cell die. So once the process is complete, the antibiotic must be extracted and purified a crystalline product. That's when they use the that's when industrial microbiology used to be making antibiotic via fermentation. And then I have one more information about how do we use antibiotics correctly, because some people may not know. First, always follow the direction carefully, and you need to finish the antibiotic even if you feel better. Why? Because if you stop very soon, like you feel better but the antibiotics hasn't finished, you stop it very soon, some bacteria maybe survive and reinfect you. That's why you need to finish the antibiotics, and then don't save your antibiotics for later. So if you are sick now, you need to take the antibiotics until finish now. Don't save it like for 2 months or 3 months. You cannot do that. And then don't share your antibiotics for with others people. And then the last, don't take antibiotics prescribed for someone else, because it may be delay your treatment. So I think that's all of the material that I can explain. Is there any question?
Thank you for the a nice presentation. Can we give applause to Vania? Okay, next, is there any question regarding these antibiotic topics?
May I?
All right, Rizkia, go ahead.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Kia. I want to ask to Vania. Previously, you mentioned that there are many types of antibiotics. So my question is, what is the difference between them? You got my question, Vania?
Okay, I got it.
Okay, thank you.
Vania, you want to directly answer it or keep it first?
I think keep it first.
All right. Is there any other question?
May I?
Sure, go ahead, Naufal.
Okay, my name is Naufal, and first of all, thank you, Vania, for the amazing presentation about the antibiotics. And I would like to ask about the antibiotics. So you stated that the antibiotics is it has to be prescribed for someone. So what I want to ask is there an antibiotic that can be consumed in general? So it's like you go to the apothec and then you just buy the antibiotic without doctor prescribed. Is that okay, or is it bad?
Okay. Is there any question?
Is there any other question? Thank you, Naufal, for the question. All right. If it's not, so I get two questions. First is from Rizkia, it's what is the differences between type of antibiotics, and the second one is there antibiotic that can be buy easily in the apothec with not with no resep dokter. All right, Vania, you can answer.
Okay, first of all, for Rizkia question, like, is there any difference between the types of antibiotics? From what I have read, antibiotics are usually they some several group. Each type of antibiotics like work for this bacterial, and this type of antibiotics works for bacterial, for another bacteria like that, or like one type for one group of antibiotics maybe for parasite, and then the other is for bacteria. So I think in here, in the types of antibiotics that I state here, this work, there are 4 classes, but I forgot what the classes are. But this type of antibiotic is work for the bacteria and also parasite. So basically, the antibiotics are grouped together based on how they work, like that. That's what I know from what the difference between the type of antibiotics. So this case, there is it enough, or is there any
Okay.
clarification?
Okay, thank you for the answer, Vania, and thank you for the great presentation.
Okay. For a novel question, actually, from what I know, that antibiotics is a powerful drugs, but they're safe. But I think if we want to buy the antibiotics, we need the doctor recipe. I don't know if we can directly buy it on the pharmacy. I don't know the first one. So from what I know, we need to go to the doctor first to get antibiotics. So now, is it enough, or you have another question?
It's okay. I get it though, because yeah, as you stated before, it could delay some of the treatment. So yeah, I get it. Thank you, Vania.
Thank you, Nova.
Okay, thank you. Is there any other question? Anyone? Okay, if it's not, let me summarize all the what the speakers that already informed to you. First is about antibiotics. So antibiotics is basically medicines that fight for disease caused by bacteria, infection bacteria in people and also in animals. And the antibiotics example can be augmentil, flagell, ER, and extra. And also the process is naturally produced by the microorganism inside the medicine is there, like fungi, to attain an advantage to fight for the bacteria. And also antibiotics treats can only treat with the doctor recipe. But is there also side effect of antibiotics, like common side effect like diarrhea, yeast infection, and extra? Okay, thank you very much for the presentation, Vania.
Thank you so much for your attention, guys. Assalamualaikum warahmatullahi wabarakatuh.
Miss Tasha, excuse me, search for the answer and question 20 minutes. So maybe the another student can add question for Miss Vania.
Okay,
please.
I'll share this screen again.
May I?
Sure.
Sure.
So, thank you for your great presentation, Vania. I'm Valenza. I want to ask, so my medicine actually, especially in antibiotics, have a certain hours of the day. Jadi, antibiotik aku tuh udah udah dijam-jamin gitu, such as having to be taken at 5 a.m. and then 8 hours later at 1 p.m. and etc. And the question is, what if we miss taking antibiotics at the time? Like we should take them at 5 a.m. I'm take them at 7 a.m. Jadi yang tadinya harus jam 5 subuh tuh malah jadi jam 7 pagi gitu loh. What will happen? You got my question?
Okay.
Thank
Okay.
you.
Pauline, I understand. First of all, I also, when I'm sick, I also got an antibiotics. But what happened when you miss the dose is you cannot double it next time. Like when you miss at the 5 p.m. and then you need to take it, and I mean when you miss maybe at the 6 a.m. and then you need to take it at the 12 p.m. later, you cannot double it. Like you cannot take the antibiotics. So you keep just eat it once, like the normal dose. I think that's it. So when when antibiotics is missed, I don't think you can double it, and then is it safe to it's normally safe and just finish it until the antibiotic is finished. So is it okay, I think, to miss the antibiotic? Is it enough?
So if I'm taking at 7 a.m. so 8 hours later, jadi jamnya tuh bakalan jadi bakal berubah gitu. Is that all right?
I think it's also safe as long as you finish all of the medicine.
Okay. Thank you, Vania.
Okay, thank you. Is there any more
Is there
question?
any other question?
Okay, please show more question. Please.
May I ask?
Sure, go ahead.
Okay. Hello, everyone. My name is Riza Fitri, and Vania, I would like to raise my question. But before that, thank you so much. The presentation is, I think it is personally, it's complete, like from the side effect and the definition and things. But I wonder about if the case is we take the antibiotics within certain dose, within certain amount, in certain time. If we take the dose, like if we miss the dose, and then if we like pass, if we miss the dose, like I need to drink my antibiotics this afternoon, but I miss it, and then I miss it because I feel like my body is better. I feel better because of the antibiotics. If I don't take the antibiotics again, what will happen with my body? Because I already feel better, even without the antibiotics.
Okay.
That's the question. Thank you.
Okay, so like when your body is feel okay, but you miss what will happen if you miss the antibiotics, right? Is it the question like that, Will?
Yes.
So from what I know, you always need to finish your antibiotics. Why? Because if you like, oh, I'm feeling better now, stop taking the antibiotics. The bacteria that your body infected can be produced or the bacteria can be grown again, and then you can be infected again. So that's why the doctor always said that you need to finish the antibiotics. It's to make sure that all of the bacteria cannot be grown again in your body. So you always need to finish it, even if you feel a lot better.
Okay, but then would that make my body resistance to the drugs, to the antibiotics, or not?
I'm sorry, it's putus.
If that happen, if I don't take the medicine, the antibiotics, if I miss the dose, and then I don't take it again, would that make my body resistance to the antibiotics or not?
I don't think that will happen. I don't think your body will resistant to your antibiotics. I don't think so, but yeah, no, I don't think it will happen.
Okay, thank you, Vania.
Okay. Thank you, Bill. Is there any other question?
Please, the last question, one more.
May I?
Sure, Safa.
Okay, first of all, thank you, Vania, for your presentations. So my questions is, since antibiotics are medicines to fight the bacterial infections, I'm wondering why the patients of COVID-19 are given antibiotics, because COVID-19 is caused by virus, right? So if you have any idea why the patients of COVID-19 are given antibiotics by the doctor. Thank you.
So you asked, but why does the patient is taking antibiotics by the doctor, right? Okay, so I think from what I know, so because when we got COVID-19, our body is got weakened, right? So I think that's why the doctor gave antibiotics, is because maybe if we got infected by any other bacteria or any other infection, it can be cause a very large damage to our body. That's why the doctor gave the antibiotics, so there is no any other bacteria that can grow in our body. I think that's it. I don't know about the specific answer why does the doctor give antibiotics to the COVID-19, even though the COVID is a virus, not a bacteria. I don't exactly know what's the reason for that.
Okay, thank you then, Vania.
Okay, thank you.
Okay, so the question session already have a 5 question. Miss, is it enough?
Sure. Okay, thank you, moderator. Okay, please, Miss Tasya, please close.
Okay, that's all from the Vania. Give applause one more time for her nice presentation. And I'm sorry if there are any mistaken. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ms. Tasya Fadila, as the moderator for the first session, and thank you very much for our keynote speaker, Ms. Vania. Okay, once again, please big applause to Ms. Vania. Wait to be the first presenter. Okay, thank you very much. Audience, please do peer assessment. I would like share about the link